Lobar pneumonia, which is most commonly caused by Streptococcus pneumonia, usually diagnosed clinically. In those who do not seek medical attention and proceed to die, a post-mortem X-ray can be used to detect consolidative changes. A 15-year-old male alcoholic was found dead in his residence. He has had a 2-day history of productive cough and complaint of feeling unwell. He did not seek medical attention. At autopsy, there was a complete consolidation of the left lobe, with a histological evidence of polymorph nitrifiltrate filling the alveolar air spaces. Gram stain revealed the presence of gram-positive diplococcus consistent with the Streptococcus pneumoniae. Next is pneumocystitis carinii pneumonia. Forensic pathology must be aware of the numerous infections that can arise secondary to human immunodeficiency virus infection. Attempt to confirm the diagnosis of public health must possible or a HIV infection. A 45-year-old male was dead in the residence after he failed to show up for oral. He had no recent medical autopsy. Both lungs exhibited complete consolidation of each lobe, histologically foamy, eosinophilic material filled with alveoli. And Groscoat stain confirmed the presence of pneumocystic carinii. Significant postmortem hemolysis interfered with establishing a serological diagnosis of HIV infection, although this would be the most likely cause of the pulmonary disease. Hantavirus infection. Some pulmonary infection, particularly those due to hantavirus, can present as diffuse alveolar damage. Hantavirus is transmitted to humans when they contact infected deer mouse, feces or urine. As such, it is most commonly encoded in rural setting. As with many viral infections, the affected individuals will initially non-specific symptoms of a flu-like illness, but will develop rapid onset to respiratory symptoms and hypotension. Death can occur within hours to days of the onset of symptoms. Lungs have the typical gross and histologic appearance of diffuse alveolar damage, though it is feature specific for hantavirus. However, this diagnosis can be made by postmortem serology. Confirmatory serological tests require non-formalin fixed lung tissue, so it is wise to freeze a small amount of fresh lung at autopsy if hantavirus pulmonary syndrome is suspected. An 18-year-old male was found dead in a bed at a rural home. Had a brief history of flu-like illness, but had not sought medical attention at autopsy. The lungs weighed excess of 100 grams of each. Histopathological findings of diffuse alveolar damage. The postmortem serology revealed IgG antibody to the hantavirus. Diagnosis of hantavirus pulmonary syndrome was suspected prior to serological infection due to, in part, to a recent regional hantavirus pulmonary arterial thromboembolia. Traditionally, pulmonary thromboembolia are discussed in the context of disease or respiratory system. Even though they are vascular in origin, their underlying causes generally have nothing to do with the respiratory. It is not sufficient to simply determine that individual had died of pulmonary artery thromboembolism. Pulmonary thromboembolia and deep vena thrombi are immediate cause of death respectively, but do not reflect the actual underlying cause of death. Although natural disease process can cause a pulmonary thromboembolia, as in the case illustrated next. This can be caused by injury, deep venous thrombosis, embolization, complicating immobilization of a fractured ankle in rest. When a pulmonary thromboembolus is found, one should attempt to identify the source of the embolus. Lethal pulmonary thromboembolia arise from large veins above the level of knees, including the inferior vena cava, renal vein, common iliac vein, external iliac vein, deep vein of the thighs. Later can be examined by making an incision that exceeds from the middle third of the inguinal ligament down to the medial surface of the knee, reflecting the muscle and opening the femoral and popliteal vein. This is the picture. The only difficulty with this procedure is that entire thrombus may embolize, so that the primary site of thrombosis cannot be seen. Another common method for examining deep leg vein is to incise the midline of the calf, expose and reflect the gastrocnemius muscle, then across section and squeeze it to see if thrombi can express forms in the veins at this level. If thrombi are present in the smaller veins, the presumption is made that thrombi are also present in the large veins above the knee. A 51-year-old male, diabetic and previous alcoholic, was found at home. Family members reported that he had been losing weight in several months, that he had appeared sickly. At autopsy, large coiled pulmonary thromboembolus was found within a pulmonary trunk and both main pulmonary artery. This arose from thrombi in the femoral vein of the right leg. Furthermore, there was evidence of adenocarcinoma of the pancreas, the metastasis of the liver. 4.10 is arose from thrombi in the femoral vein of the right leg. Evidence adenocarcinoma of the pancreas with the metastasis into the liver. Reactive airway disease. Extrinsic asthma is a relatively common disease, particularly in children, which both the patients and the parent often regard to be more of inconvenience than a serious illness. Reality is that asthma can be fatal within minutes of symptoms onset. The typical findings at autopsy include hyperinflation of the lungs with a thick mucus plugging of the bronchi. The chronicity of the disease is reflected by protrusion of bronchi above the cut surface of the lung, produced by parabronchial hyperplasia and by thickening of basal membrane and parabronchial inflammation, which usually includes numerous eosinophil. Difficulty is sometimes encountered in cases where hyperinflammation of the lungs and mucus plugging are not particularly pronounced. In this case, determining the cause of death lies as always in the providing the most reasonable opinion, taking in account the history and circumstances of the death and the pathological findings. A 49-year-old male with a long history of asthma collapsed and died after complaining of shortness of breath and tightness of his chest. To autopsy, both lungs were inflated such that the late filled with a pleural cavity. There was a gross evidence of mucus plugging with the bronchi. Both lungs were hyperinflated such that they filled with a pleural cavity. There was gross evidence of mucus plugging within bronchi, which then protruded above the cut surface. 4.55. Histological examination confirmed the presence of mucus plug with bronchi, thickening of bronchial basement membrane, parabronchial muscular hyperplasia, and parabronchial mixed inflammatory cell infiltrate, including numerous eosinophil. Okay. Forensic pathologists tend to see chronic obstructive pulmonary disease as incidental finding in individuals dying of injuries rather than underlying cause of the example. Emphysema, and chronic bronchitis can be the underlying cause of cor pulmonale with the right ventricular hypertrophy. And other clinical or autopsy findings of right-sided heart failure. These findings individuals may have terminal arrhythmia that would make their death seem sudden. They are also prone to develop pulmonary thromboemboli, pneumothorax, and bronchopneumonia. Later, two entities can be identified in postmortem X-rays. 4.120. 4.21. One of the more dramatic ways that pulmonary disease may itself known is massive hematotypsis with a sudden death. This is usually caused by a malignant lung tumor. They can also produce by tuberculosis. And conversely by any other necrotic pneumonia. 58-year-old female was found dead in her bed with a blood emanating from her mouth. The blood was found to arise from previously undiagnosed squamous cell carcinoma of the lung that invaded a pulmonary artery branch and adjacent bronchus. Thus forming a invaded pulmonary branch and adjacent bronchus, thus forming a bronchoarterial fistula with rapid strangulation. Do consider the use of postmortem X-rays as a means of diagnosing a significant or lethal pulmonary disease, particularly if the next of kin are objected to an autopsy. Perform histology, lung tissue, blood and culture, and postmortem serology, and also freeze a small piece of fresh lung in case where there is gross evidence of a typical pneumonia or diffuse alveolar damage. Remember that acute asthmatic exacerbation can rapidly progress to death in some cases. Search for thromboembolic source and underlying cause of pulmonary thromboembolic. Don't forget that the incidence of tuberculosis is on the rise, and it can be spread more easily to the unwary pathologist autopsy person than some of the virus that most people are more conscious and fearful. HIV. Thank you.